This is a question that I get asked often. Can we prevent heart attacks? How do I keep my heart healthy, etc.? So I'm going to tell you 4 things. First thing, you have to take care of yourself, right? What do I mean by this? Preventive measures work. And to elaborate, what does this constitute? You have to eat healthy, you have to exercise regularly, you have to avoid bad habits such as tobacco, excess alcohol. You have to control your stress, you have to get adequate sleep, and finally, you have to enjoy life. So this is the preventive aspect, right? This is point number 1. Point number 2 is you should know your numbers. What do I mean by this? How many of you that are watching this are over the age of 20? Do you know what your cholesterol level is? You probably don't. And if you don't, you need to know this. Just like you know the details of your smartphone or your car or other things in your life, you have one body and you need to take care of yourself. So you need to know your cholesterol level, you need to know what your blood pressure is, and the recommendations are, for example, anyone over the age of 20 should know what their cholesterol level is, and then even if it's normal, you should check it every 5 years. If you're a diabetic, you need to know what your hemoglobin A1C is. So it is important that you work with your healthcare provider and find out what numbers you need to know. The third thing, and this really is kind of, it's an extrapolation of knowing your numbers. You need to see your doctor once in a while. Just like when you have a car, you go and get it serviced every couple of thousands of kilometers. You need to have regular checkups with your primary care doctor. I'm not saying, go see a cardiologist every so often or go see a neurosurgeon, but everyone should have a primary care doctor. And you need to see them at periodic intervals so that you prevent, so that you are in control of your health. And the fourth and most important thing is do not ignore symptoms. So what do I mean by this? Many times, unfortunately, I hear the story where someone has some discomfort, they decided it's not their heart, or they asked their neighbor, or they asked someone else, and they just decided to ignore it until the next day or the next week when their doctor is back. If you have a symptom that's new, that is concerning, it does not have to be chest pain. Say sudden shortness of breath, just not feeling right, extreme fatigue, anything that's out of the blue that does not resolve in a few minutes, please seek prompt medical attention. Because although we take measures to prevent or reduce the probability of a heart attack or heart problems, this is not an absolute. So do not ignore your symptoms. Hope that's helpful. Thank you.